Hi, this is Dr. Naidu. I'm a board-certified plastic surgeon in New York City, and today I want to talk to you about breast implant revision. I do see a number of patients in my practice who come to me either from my own practice or from other surgeons who wish to have their breast implants revised. Typically, this occurs many years after the initial surgery, and it just occurs naturally as a result of changes either in the patient's lifestyle or in their bodies. So one of the reasons why patients may come back is for a rupture or leakage of an implant. So silicone implants can rupture. It's quite a low rate, but when they rupture, we do recommend that they be removed and replaced with new implants. Saline implants can rupture, and when they do rupture, they tend to have more of a slow leak, so the patient will notice deflation of the breast. In those cases, again, because it is technically a defective medical device, we recommend that patients come back and have the implants replaced. One other reason patients might come back for a revision is if they had the implants placed above the muscle many years ago. In those cases, patients can notice some rippling of the implant, particularly with saline implants. They may notice some scar tissue around the implant. So for those patients, I prefer to take them back to the operating room, remove the old implants, change the location of the implant underneath the muscle, and in most cases, we'll end up putting in a new silicone implant. And I mentioned silicone only because that's, in my practice, that is a choice of almost all patients. Size generally is a reason for some patients to come back to the operating room. Fortunately, I don't see a lot of that in my own practice. I spend a lot of time with patients going over what size is appropriate for both their tissues and their goals. Most of my patients want a fairly modest size, so that doesn't generally end up being much of an issue. But in some cases, patients want a size that's a little bit smaller or a little bit larger. They'll come back and we'll go back to the operating room to do an exchange. The implants cannot be changed in size without going back to the operating room. That's one of the questions I get asked. If they can be inflated while they're in the office or anything along those lines, you need to go back to the operating room to put in a new implant. For rippling, as we discussed, typically I'll take the patients back and we'll change the location of the implant. Capsular contracture is another issue that sometimes comes up. Right now, about 5% of patients are still getting capsular contractures. And a capsule is the scar tissue that we form around any foreign body that's placed into us, whether it's a pacemaker or a hip implant or a breast implant. Our bodies try to protect us by sealing off that little implant. 95% of the time, it's a very smooth layer of scar tissue. You never know it's there, you never feel it. And about 5% of patients, that tissue can become very firm. It can sometimes be painful. It can distort the shape of the breast. And in those cases, at this time, we'll go back to the operating room, we'll remove the implant, remove the scar tissue, and then place a brand new implant, typically underneath the muscle. And we place it underneath the muscle for a couple of reasons. One is because we have found through clinical studies that it is protective against recurrent capsular contracture. So that's one reason. The second reason is that it gives a smoother look to the upper part of the breast, so you have that extra layer of protection with the muscle, so it gives a more natural look. And the third reason is that it does appear to make the mammograms a little bit more easy to perform whenever you get to that point. One other reason for revising an implant is something called breastosis. So with changes in the body, with weight gain or loss, with pregnancy, our breasts can come down a little bit. We just lose elasticity as we age. So when that happens, we'll go back to the operating room and we'll do a breast lift. If implants are in at that point, typically I'll change them out to new implants. In most cases, the implants have been in for a long period of time, and it's just a better policy to place brand new implants at that stage. Finally, the last reason why sometimes patients come in for a breast implant revision is just to have them removed. I do see patients every now and then who are in their 60s or 70s, and they just say, you know what, I've had these in for 30 years. They haven't caused me any problems, but I'm just at a point in my life where I really don't want or need them anymore. And that's a really relatively straightforward procedure. It does require a trip to the operating room, it does require anesthesia, but it's a quick procedure, and there are typically no sequelae. Some patients will request a breast lift at the time of their implant removal. However, what I typically recommend to patients is that if you're going to do that, just have the implants removed and see if you need the lift, because our tissues actually rebound fairly well, much better than you would think. And most patients do not end up needing a breast lift at that time unless they have extremely, extremely saggy tissue. So that's just a general overview of some of the reasons that patients may present for breast implant revision. If you want more information, please go to my website at www.naiduplasticsurgery.com. Thanks for watching.